Okay, the superior oblique and inferior rectus were both responsible for depression, and superior rectus and inferior rectus were both responsible for elevation. Let's talk about both of them separately. Again, this is the right eye. We will only be talking about horizontal axis. You see this superior rectus was elevating the eyeball. However, this oblique nature, this line shown anteroposteriorly, this is the anteroposterior axis, and this line is the axis of the eyeball. If we are looking like this front, we will see the superior oblique approaching with an angle to the anteroposterior axis of the eyeball. However, if the person was looking towards the right, if the person was looking laterally, like this, now you may able to see that superior rectus is perfectly aligned and perfectly in line to mm, parallel to the long axis of the eye, and it is in perfect position to elevate the eye. So when looking laterally, the chief elevator will be superior rectus. When looking laterally, chief elevator will be superior rectus, because now the anteroposterior axis of the eye, it's parallel to the length of the muscle. It is shown with the first picture, picture number A, the one in the orange, the one where my pointer is. So although looking laterally, abduction is not a function of the superior rectus, but when with the when we are looking laterally, the superior rectus is parallel to the long axis of the eye, and it will be the chief elevator. So when we have to check the function of the superior rectus, when we are talking about the right eye, we ask the person to look right and then look up, look laterally and then look up, and that is how we check the superior rectus. Now get my point a little more on that point. Superior rectus was doing, this is the eye looking forward now. Superior rectus was responsible for looking upwards. What if that person was looking medially? You see, this is the long axis of the eye now. This is the long axis of the muscle now. Long axis of the eye, long axis of the muscle, those are 90 degree to one another now. And they have almost, I'm pulling on this, and you can see there is minimum movement. I'm pulling on it, and there is a minimum movement because I am just parallel to the axis. There is no leverage. So when we are looking medially and upward, superior rectus, it's almost not playing any role. Which muscle is playing the role here now? Then the muscle that plays the role here is the superior oblique. Now it is was coming from anteromedial aspect, so it will be the inferior oblique. Sorry, it was coming from the anteromedial aspect, and it will be responsible for moving the eyeball upward in the medially. So when we are going to check the superior oblique, inferior oblique mentioned here, we will ask the person to look medially and look up. And similarly, we can check it for the, this is the origin point that will remain the same. And if the eye is looking all the way laterally, the axis became parallel to the pull of the muscle, and it will have almost no effect on elevating and depressing the eye. So that is why the clinical testing, it is different from functions. And in a 5 to 6 years of my teaching anatomy, I have seen a lot of students getting confused at this point. So keep the functions separate from the clinical testing. When talking about the function, when talking about the function of the superior rectus, we mentioned that it was moving the eye medially and upwards. But when talking about the clinically testing, we talk about the superior rectus, we said that we ask the person to look laterally and upward. And it is not due to the fact that we want to see the lateral moving function, it is due to the fact that when we ask the person to look laterally, the long axis of the eye becomes parallel to the long axis of the muscle. So that is why when checking oblique, we ask the person to look laterally and then look up and look down for the superior rectus and inferior rectus respectively. And as you can see, the long axis of the eye, it's parallel to the long axis of the muscles. And when we have to check the obliques, we ask the person to look medially and look up and look down to check the inferior oblique and superior oblique respectively, because this is the case when the long axis of the eye, it's parallel to the pull of the muscles. Next, we will start the nerves of the orbit. I will take a little breather here, and with me the time is